Welcome back. I got my friend Jennifer here today, and she is very unconventional. We were just chatting, and she has a professional background and somehow ended up as what would you say your job is? Improvisationist? Like what is it that you got going on?
Oh, Josh, I have many jobs, my friend. Um, I think, former diplomat, crazy, pharma executive, like cons data consultant, entrepreneur, and professional improv comedian. And that's probably the only thing that you or your listeners are going to remember, the professional improv comedian, which I would say is probably the most fun and the most accidental of all those kind of vocations and decisions I've made professionally along the way.
So was starting so did you start as a diplomat? Like what was like your start
Yeah.
into the quote unquote like real world?
Yeah, so real world, I launched into um, well, I mean, even if I go back in ancient history, my real world launch was working for Apple in Prague in 1993. It was not the Jobs era, it was not the Steve Jobs era, but like way back, like that was a very unconventional move because in 1993, who was moving to Eastern Europe? The war was breaking out in the Balkans. There were refugees everywhere. A lot of these countries were breaking away from the Soviet Union. Um, Very unconventional decision, and probably one of the smartest decisions I ever took to do something like that because it showed me that I could become fearless and kind of do anything. So, yeah, so that, and then I, um, I was really fortunate in my life because one of my life's dream was to work for the UN system or even the World Health Organization, and I was able to do that coming out of Johns Hopkins. So both in North America, in Washington, D.C., and then also in Europe. I did that for about 8 years. So that was kind of the launching of me in the big girl pants, we'll say, postgraduate school, right? And then from there, I moved into the pharmaceutical sector and the pharmaceutical industry, where I led a lot of patient access organizations around the world. So in every geography, so Global South, emerging markets, Europe as well, um, Asia, and a lot of work in the US as well. And really excited to be on a board where we work for the Bill Gates Foundation to develop all the world's malaria medicines. Basically, 95% of the global malaria pipeline goes through us. So also quite unusual kind of work and amazing because we get to really save lives. 100 million treatments delivered to save lives for mostly women and children. So that's super exciting and impactful. And then, of course, the work I do as an entrepreneur, I launched with my co-founder a business 4 years ago, and we've been in market now for 20 months, and that is serving older people so that they can live at home independently. Um, and that is one of the most joyful businesses because we know we are also, again, from kind of a public health perspective, we are really doing something that is needed because the population of older people in the United States or globally even is growing on a daily basis. 10,000 people turn 65 every single day in the United States. So we have a huge, huge push ahead of this population, and there's fewer and fewer people around to take care of those folks. So we're really excited that through my company, Viva Valet, we're delivering services to olders who need them. And I guess, yeah, that last thing is the comedy. Whoever thought that me, who kind of thought this is fun, let's fool around and make jokes and play and try and just yeah kind of play around like kind of be goof offs and starting something called Lunch and Laugh in a company I worked for a long time ago where we had a group of people who came together and we would just do improv exercises inside this pharma company, and whoever would have thought that that was so transformational, both as a performer of the art form, but also understanding that using those tools really can transform leadership and transform businesses. So all of us who were doing these little lunch and laughs, kind of goofing off, we got together, we created a new business model. actually for pharma. And it's something that still is living in this company where we came from. So from those crazy origins to going through Second City, going through the whole improv program, the conservatory, having to have the sign off from all the talent scouts from LA and from Chicago and Toronto to get through the program and graduate from the program, perform on the main stage, and then now run an improv school here in Basel, Switzerland. I never would have expected that would be my life, but it is. And so here I am.
So when you were at Apple, that was when they kicked Steve Jobs out. Like he was out he was on the outskirts.
That's when I was there. Yeah. So imagine it was so, I mean, the world was different then. So it was pre-widespread internet as well. So even think of it that way. But it was in the non-Steve Jobs era. And, you know, also thinking about Prague, Czech Republic, 1993, this was even pre-Czech Republic going into NATO or of course going to the European Union. And so they were still like shaking off the kind of the chains of having been part of the Eastern Bloc, right? Having been behind the Iron Curtain. And so it was really a fascinating time because Apple was very much synonymous with the West, with democratization, with freedom of speech. And so we weren't just selling computers, and even that time, like we were selling printers when Apple still sold printers. Crazy. We weren't just selling tech, we were selling freedom and the idea of democratization, how to raise your voice and how to be connected to the West. So it was a different time, and obviously Apple was a different company then as well.
What was it like during that time when the tech companies were attempting to do as many different things as they could and seeing what people would actually buy?
Love the question because this time in history with technology is held up as one of those major examples of how countries that are maybe lagging in innovation uptake in whatever field that is. Maybe it's in telecommunications or it's in networking or just the use of computers or digitization, healthcare. Now we're looking at leapfrogging in the world of like low orbital space satellites that are enabling Wi-Fi coverage in Wi-Fi deserts. So this is one of those examples where they were so behind, they weren't digitized, they didn't have network systems, and they were able to leapfrog ahead a lot of what we saw in North America, what we saw in Western Europe, to actually be modernized more quickly. And you keep seeing these iterative loops as examples for history, like Estonia had a firewall break into their government, so they put the entire country, the whole government on the blockchain. Another huge leapfrog moment. And now you see this in sub-Saharan Africa where, the wiring of phone cables is really never really covered, but now they're going for Wi-Fi coverage through low orbital satellites that cover these Wi-Fi deserts. So it was one of those moments in time, and it's thrilling to be a part of that because you see the opportunity and the visions of those who are on the ground and making the shots, calling the shots, creating, let's say, economic incentives, commercial incentives, tax incentives that bring that type of technology forward in order to enable a faster uptake in market and transform a system. So that's what it was like in Eastern Europe with tech then.
Yeah, because I think I like read somewhere there was some sort of like government contract with like I think like AT&T or Verizon, one of those companies. They're supposed to like do all these like cables and everything, and then all of a sudden Starlink comes out and it's like we don't even need these cables anymore.
Yeah, exactly. Thank you, Elon Musk.
Yeah.
Or thank you, Elon Musk, for stealing the technology of other satellite companies that we have now seen die or be taken over. So thank you, Elon Musk, for Starlink technology.
Yeah, and I mean that's the thing that we're seeing right now is I just had I think they're in high school. High school students like asking me about like investing and things like that and they're like, what would you like to see in like the IT sector and artificial intelligence. And you just alluded to it. Like a lot of these companies can have really great ideas and they just go extinct. And then someone who has the funds and the resources, like, well, that's a good idea. I'm going to pick up where they left off and actually get it to market. So it's pretty crazy that, I mean, it happens all the time. It's just not talked about. It's not picked up on the news, and people don't really know about it, such as someone like yourself that's in the inside lane versus most people are in the outside lane.
I'm a big fan of some of the thinking of Peter Diamandis and Ray Kurzweil from Google and Salim Ismail, who look at, the major sources of disruption in an economy or in an industry, where you look at, early digitization and how from what follows from early digitization is deception. And deception comes from those exactly what you just said, like those who would not like to be disrupted. Thank you very much. So like, oh no, don't do this new innovation, don't use this new digital way. You're actually going to, kill an industry. So the digitization, deception, and then you have demonetization of it, dematerialization. So demonetization, it gets cheaper. Dematerialization, it gets smaller, more compact. Like again, like this beautiful phone that now has all the space capability, space launching rocket capability from the 50s to get to the moon is sitting on this thing. So that's a dematerialization, and then demonetization, it gets cheaper or free, and then it's fully democratized. So those are like the major stages of disruption. And I think, we talked about Eastern Europe and the tech leapfrogging. You see that in so many industries now, like biology, healthcare is one of those next frontiers where it's ripe for disruption, and it's ripe for this kind of, yeah, dig further digitization, further AI, digital biology, obviously, decolonization, even I would say, right? And then demonetization, democratization.
Yeah, I mean that's the beauty of innovation. There's some people who are going to be upset about something because something comes along that's better, and that's going to make their job obsolete. And at the same time, typically these innovations actually create more jobs than there was originally, which is a good thing. It's just, some people are going to be upset and some people are going to be happy. That's just the way anything goes. It seems like you can't please everyone. It's just an impossible task. And a lot of people get in a rut when they like can't get people to see what they see or agree with them and not listen to what they're saying and believing and listening to someone and like figuring out like why does someone believe what they believe.
Hmm. Why does someone believe what they believe? It's very personal. It's very much based on, what are your incentives? What's your history? Where are you going? What do you value? Um, you mentioned your kids. I also have children. And one of the things that I have often asked of my children is to be patient with me as I observe what type of career they end up doing or what type of vocation that they undertake. Because I say, I promise you now, whatever you're going to do professionally in your life to be your key vocation does not exist today. And just to your point of these innovations come through and they might disrupt a whole industry, they might even, reduce jobs in one area, but they'll create jobs in another area. It's the nature of the way this stuff is flowing. The quote unquote destruction of jobs that come from digitization, robots, and AI isn't a permanent destruction. It's sort of a evolution of where we're going. And so I constantly say, please be patient with me because I'll need to understand what it is you do because it will be a totally new thing. So please bring me on board and know that I'll be curious and be supportive, but know that I will not understand what you're doing in the next 20 years.
Yeah, no one knows. No one
No one knows.
no one knows what's going to happen.
Yeah, no one knows. Absolutely.
No one knows. So you moved from the DMV area to Prague. You're working for Apple. Then you transitioned to where?
I came back to Washington, D.C.
Okay, you came back.
Yeah, I was a combination of working in a hospital and studying at Georgetown at the same time. And then that's when I picked up the roles that I started doing with WHO, World Health Organization, in the Pan American Health Organization, which is based out of Washington, D.C. And that's WHO in the Western Hemisphere. So I was doing that. I went to Johns Hopkins to get my master's in public health. And it was through there that I got recruited to go into the World Bank, which was also a thrilling thing because we were working with ministers of health and ministers of finance um, who are trying to find new ways to, well, you could say modernize, you could say make healthcare systems more efficient, drive public spending in healthcare towards results that they wanted to create in terms of health outcomes. So that's basically the core of it. So we had to work both with ministries of health and finance to get them on board with this. So that was really cool and really fun. And then I moved again to WHO in Europe, and I moved to Europe and I had rotations in Bosnia, I had rotations in Armenia, Georgia, Azerbaijan, which is also a really interesting time because of the conflict with Russia in Georgia and the South Caucasus, which I was fully exposed to while I was living there. And, having those kind of unusual jobs that require things like landmine training on a daily basis or landmine mapping or um, oh, it's not like, let's say you or I are going to take a business trip today. It's like, okay, check into an Airbnb if you want, or use booking.com to book your hotel, or, fly a cheap airline. In those places we were traveling to, it was protocols like, oh, never book your room more than 2 flights above the ground floor because we need you to be able to jump out of the hotel and survive if there's a bomb threat or if there's a bomb that goes off. So it's those very unusual types of jobs that I did that I was so fortunate to do, is things I dreamed of doing, and I got to do them very young, actually.
Did you ever have to jump out of anything?
I didn't have to jump out of a window, but I did have to be evacuated by NATO once, because I was in the Republic of Srpska, which is the Serbian part of Bosnia,
Hmm.
and when the Kosovar War started. So the bombs were falling and they had to evacuate me immediately. So that, and I had to ride around in, armored cars and things like that. Like, yeah. In Bosnia, it was really special. I did see things that, you don't want to remember, of course, in those kinds of places. And we were there. And again, I know the world has changed since that time. This was in the late 90s, and the world has changed, because we now have resettlement of populations that had been moved along, or we have peace effectively. And, the great peacemaker is economic activity. And so what I see in the Balkans is this desire to grow their economy and to live, they're getting along, right, across the miniature borders. But I would go out, and we were registering people to vote, um, which was a part of resettling Muslims who had been effectively ethnically cleansed out of Serbian territories. They would bus those people who had been displaced back into those homes, and we would register them to vote, or we would oversee the voting. We would ensure that there was peace, and safety for those people who wished to return in those places. And there would be days when you drive out in the morning and you drive through a neighborhood and you drive back in the evening, and maybe one of the houses you drove past had been blown up during the day. Those kinds of things happen a
Oh
lot.
my gosh.
Yeah. I guess, Josh, this is a bit unconventional. I guess my career has been a bit unconventional.
Well, I mean, you're saying these things that are life threatening, and some people in the world can't even walk outside with having their like head on a swivel. And you see things that are happening in America that people are upset about. And then you kind of think about like what other people are going through throughout the world, and you're like, why are people so upset about this when other people are going through that?
Oh, sure. I mean, yeah, when children are dying of malaria and we're sitting back and in the global south where they're rather eager to take on vaccines, for example, because they know that it saves lives, and they witness the transformation in their communities, by people, by children surviving, by not dying of childhood diseases. And then we see this in North America where there's such resistance around vaccination. So that's an example. And I don't want to touch such a hot, that's a very hot topic. I realize there are many other hot topics that are even hotter, but I want to be careful. But you're right. Like, I think in the end, someone else's suffering can be abstract and not relatable if you don't understand what that means for yourself and your own environment. And I have compassion for people who suffer from even first world problems because they're stuck. When I say I have compassion for them, I they're stuck in their own heads and they can't get out of it, even to have compassion for someone who has it much worse. So I think for people like me or people who are, touching those environments, our responsibility is to educate and to raise awareness that, you do have it well in the global north and the global west. And how do we continue to raise awareness that there are many people in the world that are less fortunate than us that require our help?
Yeah, I mean, most people don't know how good they have it until it's gone.
Yes. Yes.
And it's interesting. Obviously, there's a lot of things going on with America and the health with like Robert Kennedy and things like that. We don't have to get into those topics. However, it's interesting because I was watching there was a documentary. I don't know if it's new or I just stumbled across it about like Catherine Graham of the Washington Post.
Yes. Oh my gosh, have you ever read her book, her autobiography? It's
No, I haven't
fascinating.
read it yet, but I
It's
mean, won a
so good.
Pulitzer Prize.
Yeah.
And I mean, the things that happen, like there are people out there who are looking to like educate and let people know like the truth about things. And we've been seeing like some of those people aren't able to get like their voice out there to help, educate the world on the best ways to take care of themselves. And I found it interesting that this has been happening forever. Like regardless what the medium is, whether it was a newspaper or, something on now the internet, like being able to share your opinion, regardless of whether people want to agree or disagree, is like one of the beauties of America and being able to share your thoughts and not being at risk at like one day I logged into like my YouTube channel, not a big channel or anything like that, and the whole account was just gone. The entire thing was just wiped out. Like companies like Google have the ability to do that if you're not doing things that they agree with on their platform. However, there's only so many ways like the little person can get their voice out there, which social media is the easiest one.
Yeah.
And I mean, it seems like the healthcare system in America, it seems like the insurance companies are like the what's like really causing a lot of the friction there.
Well, that's a very loaded comment. And as someone who's been a student, a teacher, an influencer, not in the Instagram sense, but like a influencer in terms of policy making and health policy, consultant, I think in all those kinds of roles of healthcare systems globally, to see like the vast differences that are associated with different ways that governments choose to construct their healthcare systems.
Hmm.
And it's very much driven by political values that are underlying in the culture. And so if you think about in the US, um, we have a political culture that is inherently libertarian. And I don't mean the libertarian political party, but in terms of a political philosophy, this idea that we are able to choose whatever we like. We can choose our destiny. We can choose, the contributing factor for our own personal health. Like if you want to smoke or you want to vape, go for it. It's your choice. And then if you get a disease that's associated with that, lung cancer, then it's sort of like, well, you brought it on yourself, kind of idea,
Hmm.
right? But anyway, we fundamentally, it's about choosing everything. choosing how you live your life, how you end your life, how you are able to navigate on a daily basis, not only in healthcare, but just in life in general. And I think if you contrast that with like where I live in Europe, you've got countries that are like more egalitarian or like egalitarian, social egalitarian. Often that's called socialist, which is not like socialist in the form of the Soviet Union, but they're
Right.
social egalitarian. And their idea is like kind of all for one, one for all. Like we're all in it together. And you see that the construction of a healthcare system looks very different in that type of environment that is driven by that type of political philosophy, because it's about everyone should have access to healthcare. Everyone should have universal access to education, healthcare, all those types of social services or public services. They should be widely publicly available. As a result of having wide public availability, you have less choice. And so the complaint from the citizens on that side is I didn't get to choose, but I got it. Whereas in America, you say I got full choice of absolutely everything. And the hurdle is access. So you don't get access. Access is on your ability to pay either through your own out of self pay, out of pocket, or it's through your insurance coverage. But that's the barrier. So you can kind of choose how much you want to spend of your own personal wealth or not in your system, and then you can get access to anything, to anything you might choose. So I think that's like a really like huge, dramatically different way of looking at it. If you just look at it from political philosophy of how that's influencing everything, like government spending, defense spending, education spending, infrastructure spending, and of course health spending too.
Right. Yeah. And it seems like a lot of the things that people like want the insurance company to possibly cover that they feel like they're entitled to is what you're saying is like preventable. Like a lot of the things are preventable and people need to make smart choices like hey, like go outside and walk, get some sunlight if you can. Just like simple little things. Um like the World Health Organization though, like that focuses on like big problems like you were saying like malaria. I know like polio is still like a one they're attempting to eradicate completely. I mean, it's close. Like I like
Right.
I know it's close, but I mean it's not like at zero. Uh,
Yeah.
Now, what you learned and what you experienced in the World Health Organization that helped you go into like healthcare and pharmaceutical development. That was like the next stepping stone for what you went into next.
Yes, exactly. So, um, along the way of doing this work with WHO, I moved, I did an MBA, like some people do. And I think the natural evolution of that was to say, all right, I'm going to leave the public sector in the form of the UN system, and I'm going to go into private sector, excuse me, in the form of kind of utilizing that knowledge of healthcare systems and healthcare policy and putting that into the art of drug development and drug commercialization and patient access. So that was about a 20-year career actually in pharma development. I'm still doing that, like I said, with malaria and the Medicines for Malaria Venture Board. And what I experienced of the transition, I would say, from going from the public sector into the pharma sector was I went from being kind of a referee on the sidelines to actually being a player on the field. If I can use a sports analogy, like a soccer analogy, like maybe a line flag, like a ref who's a flag ref on the sidelines versus actually calling the shots, making the rules, driving towards scoring goals as an active stakeholder. And when I say that, um, maybe it's a little bit of a contrast with WHO is that although, yes, they do very serious and what we call important things, a lot of it's disease surveillance. A lot of what the WHO does is around technical exchange of knowledge and
Mm-hmm.
kind of consulting that's free associated with this public sector institution. When you're inside an industry where you have a point of view and you have a side to take and you're actively making decisions and even maybe say shaping decisions from the pharma side, I felt like I was actually a more active player in the game. And I felt more fulfilled as a result of that because I really was creating programs that were both creating medicines for patients that need them or they didn't have treatment available before, like in rare diseases, new options in hemophilia, new options in rare cancers, for example, or rare diseases in general, or new options in neuroscience, just really exciting stuff. And then creating the the access programs that go along with them to make sure that patients get them wherever they need them in the world. And as beautiful as that statement might sound, it's actually really hard to go quickly and have fast launches in markets, especially emerging markets. So that's something that I champion personally in many of the companies that I worked in, which is how do we go from developing a drug, launching it in the US, because it's always coming to the US first, and how do you compress the time or shorten the time between a launch in the US and a launch in a country like India or Nigeria? So we worked out a lot of different mechanisms to get there quickly. And some of them, one of them was a lever. One of the levers, sorry, was price, sure. And one of the other levers were, making sure that you had clinical trials that were in those countries, making new partnerships with governments in those environments as well. So really incredible work. And like I said, I went from being a referee on the side of the field to really being active player. Yeah, and um, it's really exciting to develop new drugs. Actually, it's really really cool. It's a fun thing, especially the earlier you're involved in the transfer of, let's say, from discovery into early patient use in clinical trials. It's fascinating, the process in how everyone has a stake. And if you're not at the table, then maybe the thing that you need out of the drug isn't being represented in the clinical trial, which is going to be important because it's going to come forward in the labeling and how it's used and how it's taken up in the healthcare system or how it's paid for. So to have influence in that stage inside a company is really cool.
So when you were there, did you make any decision that had a positive impact on the world that you're most proud of?
I made lots of decisions. I made lots of decisions that made a positive impact, or I made a lot of pleading, tearful, even tearful pleas for certain clinical trials to be funded. I remember a specific day in Rome, ask talking to a specific head of a pharma company, and with tears in my eyes said, "Please don't give up on this Alzheimer's trial. The patients need it." And being there, watching this person sign off on a $500 million development program on Alzheimer's drugs, and unfortunately, those drugs failed.
Mm.
This is part of the high risk that's associated with a company like that. Sorry, with an industry like that. I think a lot of people look at pharma with criticism, and sure, there's plenty of reasons to be critical of pharma for reasons I mapped out, like maybe you're slow to get to patients who need them in emerging markets. Maybe you didn't study the right populations. Maybe the pricing is off. Like all of these things are of course worthy of discussion, worthy of debate, and sometimes very much worthy of criticism. And there's a lot of space for improvement in all of those areas. And I think also what's forgotten or never really fully discussed is the financial risk that's associated with going for these massive assets. When just seriously, Josh, like imagine I've had many relatives who've had Alzheimer's and Parkinson's, and it is such a scourge of a disease, and it's they become a prisoner of this disease, these patients who have these degenerative neuroscience diseases, neurological diseases. If we had medicines that actually could reverse the disease process, it would be such a game changer. We could extend lifespan, sure, but also health span. So people who are in those late years would be able to have like a productive, purpose-filled life, which would be like that's what we're about, right? It's what we want to achieve. Um, and those are huge risks to invest in those areas. And so I've watched a pharma company put in 500 million in those development programs and they failed. or put in like you're putting in 1 billion into a new disease area and it fails. So it's a very high risk area of investment. And I think it's really, instead of looking at it as, greedy, money grubbing folks, it's like this is actually a measured risk that's being taken by a group of people that are trying to decide where we're going to invest our bets across a wide range of disease areas and different assets that could or could not fail or succeed. And you just won't know until you get through the clinical trials. And sometimes you get very late through the clinical trials, late meaning like late phase 3, which means that you've already gone through one to understand any toxicity. So it's once you go from discovery into early clinical, then you go into development. Like the phase 1 is you are measuring, is there anything that's going to be, is inherent with the drug that's going to be toxic? So looking for any toxicities that would say it's a no-go. Then phase 2 is about what's the dose? Like, is it 2 milligrams? Is it 10 milligrams? Is it 20 milligrams? We're trying to figure out what's the right dose that gives you the right efficacy or usefulness in the body without making someone sick. So it's that sweet spot of like too low of a dose, you don't have clinical activity. Too high of a dose, you might have side effects. So you have to find that sweet spot. That's what phase 2 is all about. And then phase 3 is saying, okay, we've selected what dose is the most um, like clinically powerful, we'll say, or effective, or have effective. Then you go for these really large populations to say how, like, could be 1,000, 10,000 people that are going into these clinical trials to say, does it have a long-term effect? Like, does it really like um, get a patient into remission from cancer, for example, or even like if you have a schizophrenic patient, does it keep them from having these very predictable, expensive events like going to the hospital and having breakdowns? So those kinds of things. So it's a hugely expensive process once you get all the way through there, and you might have sunk 1 billion, 2 or 3 into a development program, and it might fail at the very end. So it's hugely risk. Sorry, we're talking a lot about drug development, but it is part of the journey that I've taken in my own life, and um, I'm really glad I got to do it. I'm glad I got to be a part of that and to be able to speak truth to power in moments when it need to be spoken to bring the right voices around the table to make sure that we were measuring the right stuff. And that when we designed some of these clinical trials, that it didn't harm patients more than it needed to. And when I say that, like, do we hassle them? Like, are we drawing too much blood? Are we making them travel too far from clinics? What could be done virtually? What can we check in on? Those kinds of things to make it as easy as possible for patients who volunteer to be part of these clinical trials. They're giving their time, they're giving weeks of their lives, months of their lives, maybe years of their lives, potentially exposing themselves to something that could be risky or something that could be life-saving. And you just don't know, and they don't know either. And so I'm always so grateful for patients that are part of those clinical programs, because without them, we wouldn't be able to have these new medicines in place.
Yeah, these are like unrecognized heroes that participate in these things. And it seems like we're getting into like everyone's DNA is a little different, like, really getting more specific based on like each individual's DNA and being able to use those things to figure out like the right doses and figure out like, hey, this works well with this DNA, doesn't work well with this DNA, and like getting really specific. So it's pretty cool that we're getting to that point. And even though there's billions and billions of dollars that are poured into these things, it just gets us a little closer, even if there is a failure.
Yeah, exactly. I mean, it's all about learning, right? So the good news is we can take all the data that comes out of those clinical trials and we can apply it to learning, and we put those things in what we call, this is what I do on a day job right now, data sets where we look at what we call real world evidence. So we can put that into AIML to also be part of machine learning and be part of constantly teaching the large language models about human health and biology. And as we get more and more into AI driven decision making in healthcare, it is an imperative that we educate those LLMs, that we are getting the right data to do the right AI/ML to be predictive. So that means, looking at the world of clinical trials, making sure that we have geographical representation, we have gender representation, that we have age representation. I think for me, running a company that specializes in caring for older adults, specifically those who are like in their 70s, 80s, and 90s, making sure that we have data around those populations, because like never before in our global history we ever had people who are so old and healthy. That's the thing, they're old and active, and they're going to perhaps have some of the diseases that would be diseases of old age, but they're popping up later. So
Mm,
maybe someone who's 70 might have been near death, 20, 30 years ago. Now we're expected to live at least another 20 years once we turn 65. So again, already congratulations, we're winning the genetic lottery. We're winning the lifespan lottery. How can we make sure that we're extending health span so that as you live longer, you still have a joyful life and a healthy life to be a part of? I think psychologically and from a sort of interpersonal perspective, are you living with purpose? Do you have quality social connections? Are you doing things that you love to do, or are you just sitting around waiting for death? I think that's something that's a debate we have in our company. It's a debate that I have with our customers when I interact with olders. It's like, I never ever expected to live this long. And therefore, we're talking about AIML with older people, they didn't expect to be having to deal with complex diagnoses in their late 80s. And so there's no data that really helps doctors understand, I don't know how this drug's going to work in someone who's 80 or 90 because I've never treated a patient this old. So this is where we need to really bolster the data to support that,
hmm
or support
It,
doctors.
yeah, it definitely could put people in a tough position because the decision they make is like, do I seek treatment or do I just live my life and not seek treatment, which is a huge decision in someone's world.
Yeah.
And it could be a tough decision. Uh, do I attempt to stay on this earth longer or do I say, hey, I've had a good run. I'm just going to live my life and see what happens and enter into the unknown,
Mhm.
which could be, people don't like the unknown. People like certainty. So,
Yeah, which no one has, right?
no.
No
So,
one has.
so with Viva Valet, what is the hole in that industry that you are filling? Because with every great organization that people start, you're looking to fill a gap that isn't being served.
A gap, or one could say an itch that I'm trying to scratch, which I desperately have myself. And I think already when you think at the N of one, who's your ideal customer? If you're solving a problem that you passionately have to work through and that you are struggling with yourself, and if you find a buddy like I did who's also struggling with the same thing, you'll find that there are others who have the same problem. So the problem that we're trying to solve is we live very far away from our aging relatives, and we want to be a part of supporting them in their later years so that they have an independent life. And so all these things, so that they extend their health span and they extend their sense of purpose and joy and the love of life. And also, if they become ill, how do we support them if they have moments where they need extra care to live independently? So the gap for us was, we're far away geographically. So that's a massive gap. So we're going to have to find a way to create some type of digital solution or platform that enables us to bridge that gap. The other gap is those type of services that we're talking about that would need to go into older's home. They're quite fragmented in terms of, where do you find them? What do you need? How do you curate them? What's most importantly, what's a trustworthy, high quality, trustworthy service? So if you imagine like you're going to go on a vacation and you use Expedia, or that kind of platform can curate your flights, your rental car, your hotel, or any other deals that you might want, or even, tour guides, all those things you can find in one place. That's ultimately what we're providing with Viva Valet. So these are the services that an older would need to live at home independently. So it could be rides, it could be food delivery, it could be cleaning services, it could be home safety assessments and modifications to enable safety, like grab rails, carpeting, making sure that stairs are safe, those kinds of things, huge part of our business. And you're going to be surprised to hear this last service, which is one of our really growing services in popularity, is senior tech. And what I mean by that is tech training in the community and also at home as well, setting up your networks, figuring out how to set up tech, how to manage tech, how to use your iPhone. Um, we have customers who are incredibly passionate and curious about learning to be involved in technology. And part of that is that in order to participate in our society, in our economy, you better get online if you want to be able to bank ever again, right?
Yeah.
So, if banking is online, again, we're talking about olders. There are people that utilize healthcare the most in our entire population. They're the most active in healthcare, and therefore all medical records are digital. So if you want to access your chart, if you want to access your lab results, you have to use the portal. And very often you have to go through the portal to do Zoom meetings with your doctor because you might be having remote appointments. So there's a huge space where olders need to get up to speed and they wish to get up to speed. So we have a lot of traction in that area. So we love that. And right now our business is currently in Illinois. So our home market is Chicago. Um, and that's becoming more and more of like a demonstration or showcase of what the physical services are. And we're expanding more and more to like a national concierge where you could even call us and we can set up appointments and we could find the resources that you need if you're in a different state or a different country for that matter, if you're older.
Yeah, because just because someone needs help with one item of like their activities, like insurance companies, I think call them activities of daily living or something like that, doesn't mean you have to just throw them into a full on nursing home.
Yes. So from the research we've done, both like qualitative ethnographic, which is super fun that we got to do, as well as like large scale, like quantitative studies, focus groups, et cetera, 90% of older people want to live in their home. And that's like the home they've lived in for the last 20, 30, 40 years. And that's, for thousands of reasons. It's because they prefer. Or, from a memory care perspective, you don't want to change anything when someone's losing their memory in
Mm-hmm.
terms of dementia, Alzheimer's, Parkinson's, because those physical objects, the way that they're arranged, or even the smell associated with home, is part of like the totems of grounding you and keeping you rooted to your environment and your memories. So you change the environment, like put someone into, like you say, a nursing home, assisted living, they lose some of their ability to really navigate their life or know who they are. So that's really critical. They want to stay home. The other obstacle is you may not the facilities that they might need to go to maybe aren't there, or maybe it's just a financial hurdle that they can't overcome. So if you're gonna get care in your home, it's a minimum starting ticket of around 50 to $60,000 a year in the US to get in-home care. And
Mm-hmm.
then the opening ticket to move to one of these places is 90,000 a year. And many people don't have those resources to be able to do that, to receive that type of supportive living. So our intent is how do we mobilize the environment, small businesses in communities, bolster them, support them, certify them, really like, yeah, give them a certification or accreditation that they're able to work with us. We train them. And like we train like literally like go to school of how are you going to take care of olders, how are you going to give services to olders versus you and I who are walking around. Um, or they have to do test visits, and we always have our eyes on them as well, so we can always report back to their adult children or themselves. How did it go? Was there anything of concern of the visit that this service provider actually saw? Was it like, is the environment something strange going on in the environment that a family member needs to know about, or something strange in their behavior or their health that they need to know about? So it's constantly the system that supports the whole family in the safety and the management of an older remotely and independently. So it's very exciting. It's sort of this heart-led, not it's sort of it. I don't want to diminish it. It is a heart-led business that is a sweet spot in the form of where else, the tsunami of older people. So where else are you going to find such a large growing population that needs your services? So again, the silver tsunami, we've often described it as, it's coming. By 2050, we're going to have 85 million people in the US who are 70 and above. So that's like today, the population of Germany, like the entire population of Germany is going to be that many people in our country, who are of that age who might need this type of service. So again, perfect storm of, you've got fewer people in the environment who are able to do this in terms of caregivers. You have fewer family members because people have smaller family sizes. You have bigger needs because you have more people. And you have bigger needs because people will need more assistance as they get older. And just from the physical perspective, they're going to need more help. So, and you have an environment that's becoming technical and becoming digital. So we're never going to slow down the digitization. It's going faster every 6 months, right? We leap ahead with our ability to, you know, create new data, create therefore new insights, to the body of accessible human knowledge, really. We will not be slowing down any of this digitization. But what we can do is we can speak on behalf of those who aren't at the table, maybe those people who are older, who are going to use the technology, put them in the center of design thinking, put them in the center of UI UX. That's actually something that we did, was we had them sitting on our UI UX panels and testing every beta. They were the first people that tested. So a panel of people from 70 to 93 were testing our tech every week and continue to do so. So yeah, like we have that choice to actually step in and be a part of designing a future that we all can age into, and therefore prevent the move. Ultimately, it's we want to prevent the move into assisted living or delay the move and keep people living independently. So honestly, Josh, it's like such a labor of love. It is not an easy thing to do, and it is such a beautiful thing to do for people, because our customers that come to us, we have like a 98% retention rate. They do not leave, and they are raving fans about the kind of support that they get, to be able to live at home independently.
Yeah, I imagine just being able to help someone learn how to get groceries delivered in case they can't drive, or just being able to call a rideshare to take them to go play pickleball. Um,
Yes.
some people look at it as like, well, like, I can't drive anymore. It's like, well, you don't have a car payment, and a lot of these services are being improved. And when services are improved and technology gets better, it brings the cost down. And if it brings the cost down, that means people who just need a little bit of help don't have to dwindle their savings just to go into a assisted living home per se.
Yeah, 100, you totally got it. Absolutely 100%.
Yeah. So is that where the name comes from? Viva, like to life?
Yeah, so it's life valet. So a valet is like a butler kind of idea, that, someone who could be concierge, butler, sort it out for you. And so the name Olders and the name itself kind of was sourced from the early research we did with our customers in the form of ethnography, where we put cameras in homes and we did lots of observational studies of like, how do Olders want to live on a daily basis, and how technology might help them. And they said, what I really need is a butler. What I would really love is to have someone come and sort all this out, be it technology, be it some of these things that I don't wish to do but have to do, so I can get on to living things, to doing the things I choose to do, because I've earned it. Like at this age of my life, like I should be able to do whatever I want. So like you mentioned pickleball, like I should be able to go play pickleball instead of having to do my laundry, kind of thing. So that's a lot of the thinking behind it. It's this life valet, Viva Valet. Yeah.
Yeah. How you choose to spend your time throughout the day is important. And sometimes it's worth paying, and I don't want to say paying, investing to have people help you, because regardless of your age, change is hard.
Yes, change is hard.
So
Yes,
it's
hard.
just like, you start changing things for your little kids, all of a sudden they freak out. So change is hard for everyone. Um, and what you're doing is super cool. And I was so happy to have you on. And we'll see
I'm so
everyone next time. Bye, everyone.